Okay, afternoon everyone. Thank you for joining for the Integrated Care Partnership today. You've got the pleasure of me chairing because both Councillors Abbott and Martin are not available. I'm Cathy McLean, I chair the Integrated Care Board and indeed boards across Nottingham and Lincolnshire as well as here, but today we're focused on Derbyshire, of course. We've got a number of apologies, which I think you could just let us know of. There's quite a number actually today. I think there's something about December, isn't there, that makes it all a little more tricky.
So apologies are from Councillor Dawn Abbott, Councillor Josh Barnes, Councillor Alison Martin, Councillor Sam Redfern, Stephen Bateman, but Sabia Hussain is covering, Gino Di Stefano, Ellie Holston, but she's got cover as well, Sue-Ann Lim, James Moore, Alison Noble, Mark Powell, Gemma Poulter, Lisa Holford is covering, Amanda Sullivan and Nikki Doherty. And that's all I've got. Are there any more?
Gamal Nizar, maybe an apology as well. He's an apology if he's on the list. And Andrew Appleyard may be late.
He's here.
Okay, thank you. However, I believe we are quorate, but actually the agenda today doesn't require any decision making, so I think we're fairly safe. Declarations of interest, I assume people keep those up to date, but I couldn't spot anything particular. Anybody want to raise anything? Nothing today. So, the minutes of the meeting on the 15th of October, anybody got any corrections to suggest? No, so we'll approve those. Thank you very much. As I say, we've got a couple of items today, and the first one is on a topic I think that we've touched on before at this meeting, but it's really, really important, is around Start Well. And I think Andy Smith and Nikki Smith, sitting here together, are going to take us through this. Thank you.
Yeah, we're not related.
No.
We have the same surname, but we're sitting next to one another.
I almost said that, but
yeah,
I thought
I
you
know,
might.
I see it in your eyes, Chair. So I'll just introduce the paper, and really pleased to introduce the Start Well update, which forms a really important element of our integrated care strategy. So Start Well remains one of our system's most important priorities, ensuring that children have the best possible beginning in life, from healthy pregnancies through to entering school, ready to learn. So what the report does is provides an update on our emerging plans, particularly in light of the NHS medium-term planning requirements and the implications of local government reorganisation. We've made early progress, especially around supporting children with speech, language and communication needs, including the successful joint pilot between Derby's family hubs and speech and language therapy. We're now building on this learning as we align Start Well more closely to the neighbourhood health agenda, with a stronger emphasis on prevention, early help and improving school readiness. So I'll stop there, Chair, and just hand over to Nikki to take us through.
Yeah,
We've got a slide deck, I think, haven't we?
Yeah.
Have you put your...
Sorry, apologies. Thank you. So to start with, I just wanted to recap on the Start Well outcome and our vision of the Children's and Young People's Delivery Board. So Start Well is all about women having a healthy pregnancy, children are born safe and well into a nurturing and secure relationship with caregivers, with good nutrition, access to healthcare, social care and education. Children thrive and develop positive and healthy relationships. And our key measure within this is the National School Readiness Indicator. The Children and Young People's Delivery Board is co-chaired by Andy and Ali from Derbyshire County Council, and our vision there is very much aligned to this in terms of ensuring seamless health, education and social care pathways for children and young people. One that enables all children and young people to be healthy and resilient, and if support is needed, enables them to plan their care with people who work together, allowing them to achieve the outcomes that are important to them. So obviously keywords there are around pathways, enabling, support, working together, and out with a focus on outcomes. So, as Andy said, we have been delivering Start Well ambition through various projects and work streams over the past few years. The enabling factors of delivering it on a wider scale we've struggled with and meant that we had to deliver a reduced programme of delivery. As Andy said, the publication of the NHS 10-year plan, the medium-term financial planning framework and other NHS guidance defines the delivery requirements of the NHS up to 2028 and 29 and requires the accelerated delivery of neighbourhood health. Both the NHS and local authorities are undergoing significant change at the moment through the NHS restructure and clustering and local government reforms, and this for us presents an opportunity to refresh our plans. So we already have a model for integrated care and neighbourhood teams through through adult pathways, and we're looking to build on that for children. Obviously, education, early years settings, and health visitors become key partners in that, particularly when there's an alignment to Start Well. So in terms of what's next and where we're going, we're keen to refresh our strategy with a renewed focus on neighbourhood health and the Families First partnership programme. We are clear to want to establish a clear direction of travel that's embedded across the system. We're looking and working with colleagues in the Integrated Place Executive to define a clear framework and guidance for children's neighbourhood teams. That work's underway. And we're looking for a greater attention to joint working and impact through a clear programme of underlying individual projects by neighbourhood that are resourced and held to demonstrate progress and impact. Thank you, Chair.
Thank you. I think we can open it up. I mean, this is a hugely important area, isn't it? And I suspect one that we will want to, absolutely embed into the neighbourhoods, but also, in that partnership way, but also ensure that any refresh of strategy going forward does include this is a really important. I've got a number of comments and questions, but I will hold mine in the favour of everybody else. Yes, please.
Thank you, Chair. You're doing a great job stepping in, by the way, so far. Just one really brief comment on 4.2 and the definition of Start Well. I suppose implied in Children Thrive in the final sentence is the idea of being physically active. But I'd like to see that actually as part of the statement, because good nutrition, definitely, but also paired with activity, physical activity, that helps us against the healthy weight initiative. And there was a report recently, I read it in The Guardian, about how physically active young people are, and they are actually more active, I'm pleased to say, from the report than they were the last time it was taken. I think there's a 5% uptake in physical activity, so it's great. I don't know what that says for Derby, that was the national picture. The second point, really allied with the really important issues in 4.9 about good level of development connected to best start in life, of course. And there's a real push from that by the government. It's prevention, but it's also getting young people onto the right, or little ones, onto the right path to really thrive when they get to school. One of the issues that we all will be concerned about is the number of families who are in temporary accommodation. And I'm really pleased to say that Derby Homes, the City Council and various other partners in the voluntary sector are having a more coordinated approach to those families. And I'm concerned with families with children, clearly, but all families. They have appointed a child practitioner solely for kind of work with families in temporary accommodation, which is a massively positive move. I'm just thinking, is there anything else in the health space that could be done to complement what's being done? On whether the child practitioner has a kind of clear route to people and clear ways of getting support. Just out of interest, in terms of the numbers of people that come through for temporary accommodation, we're dealing with something like 2,400 families per year that are coming into the system. So it's an immense pressure on finding accommodation for them, and accommodation which is suitable. And I would fear that in some cases, because there's no other option, the actual accommodation is insalubrious, shall we say, and therefore is a health issue. Thank you.
Thank you. I don't know if Andy and Nikki want to respond to any of those particular points.
Sorry, thank you. So yes, absolutely take the point about updating the ambition, the outcome. We'll take that on. I think we all know that the wider social determinants of health and how important they are, and I think absolutely key to the success of neighbourhood health is coming together with partners, isn't it? Yeah. And housing is obviously a really key part of that. So that would be our ambition, that we work together in that space. Yeah.
Good. Excellent. Thank you.
And then just to add to what Nikki said, I think the point you raise around the temporary accommodation is a really important point. Colleagues may be aware that the government produced their National Child Poverty Strategy last week, and within that there is a real focus on work to prevent children with their families living in temporary accommodation for any longer than necessary, and that is a specific, and probably going to be a specific new legal duty on local authorities, but clearly we need to see that in the broadest space in terms of what that means for the way in which partners work together to try and tackle that. Yes, clearly there will be a local authority asking that, but in terms of looking at that wider good level of development indicator, in terms of the work that we have to do to really try and help children be ready for school in the broader sense, I think that there's some really positive stuff that we're doing in our family hubs, which is absolutely rooted in that multi-agency way of working with partners from our providers, as well as from local authority, early help, family help, and also that broader family of schools working together. I mean, you'll know from the paper that we're in a challenging space around our GLD performance in terms of how that's measured by government, and that's because of some of the real deep-rooted deprivation that our communities face and the impact that has on children's early development, which again forms a really important part of this priority and is why we've got to root it in that real way in which we work collaboratively in communities at place.
Thank you. I think those are all good points. Duncan, and then come to the back.
Thanks. So I'm a real advocate of a neighbourhood way of working and a collaborative way of working. But it's not new, and I think that part of the reason for this group is a bringing together of health and local government. So I'm slightly nervous when it's painted as a solution when we've been trying to work in that way already. And reading through this, I'm slightly nervous that health perhaps isn't carrying its weight in trying to achieve this, because most of, and certainly what Andy was just describing, isn't sitting with health. And I think one of the statements around the finances, that it's really stretched, and one of the limitations of the programme is the lack of resource that's allocated to it. So I guess it's probably a complex question around what's actually going to be different. So describing neighbourhood, even though we've been trying to work in that way, I'm nervous that we're seeing it as a solution when we've been trying to do it already and we're just kicking the can down the road. And perhaps a comment around what's the actual implications of there not being adequate resource allocated to this programme of work as well.
Any comment on?
Yeah,
Well,
if I can, thank you. So I think having started the work to look at what this means and what needs to be different and how it changed, what we've realised is that we haven't got the enablers in place at the moment to enable local areas, local partnerships to come together and to offer that. So the work around the framework and the structure is really about trying to support that. What we're really mindful of is that it's for individual areas to define what it is that's needed in that areas, and we can't come along and dictate that. It has to be led by the needs of the local area. So I think that's where we are. What we're looking to do is put in place some of the support and the enablers. The question around funding is a really interesting one. I'm not sure I can answer it, but I am going to look at Andy and see if he can add to that.
Yeah, I can certainly add to that. I think, you're raising a really wicked issue, aren't you? And it does feel a bit like Groundhog Day sometimes when we have these conversations, because we can sometimes lose ourselves through trying to really understand and define what we mean by community and by neighbourhood, and what do we mean by multi-agency working, and how do we really work in that holistic way based on what we think are the needs of a particular community. And that will be different depending on which part of Derby or Derbyshire that you're reflecting on and looking at. I think that the other thing that compounds that is, the scale of different elements of the reforms that are taking place at the moment. It feels like a really busy landscape. It was busy when we started to develop Startwell approach and strategy. So on one hand, you've got very impressive engagement from the system in this space. I genuinely feel that children's is not an add-on in the Derbyshire space, and that will hopefully continue in the wider cluster. And certainly in terms of Startwell Group, it's got the right people across the system at the right level who attend month on month. So there's really good engagement, and we are having increasingly more strategic, tactical conversations about how do we try and join up our insight and understanding in a way that's going to impact, because we can be quite siloed in how we think sometimes, and that can be a bit of a challenge. I think that what we've got to try and do now to try and move this forward is how do we try and navigate the reform space and the changing landscape that's coming out of government in a way that really tries to galvanise and bring bits together. So, for example, we're talking a lot in the health space around neighbourhood health. So how do we try and ensure that isn't just an NHS conversation, that it isn't just adult focus, that it also focuses on children? And how do we link that to the conversations and discourse we're having around our family hub development, both in the city and the county? How do we link that to the work that we're doing around the government's approach to early help and children's social care through the Family First partnerships, so that we're having a much more joined-up conversation, often about the same kids in the same context, but coming at it more collegiately rather than in our silos. I think that is really hard, because it sounds really easy when you say it, but I think bringing that together is quite difficult. But we are having increasingly, I think, more constructive conversations across the ICB, provider and local authority space around what we mean by neighbourhood health, around how we kind of bring the reforms into that perspective. God forbid, how does LGR start to play into that as well? Because that's the other thing we've got to try and navigate going forward. I just think we have to not lose sight of the end game. I think it's the last point I'd say, Chair, around the resources bit. I think that is a bit of an elephant in the room. I think Startwell has been, the poor cousin once removed compared to the other priorities in the ICP. It's pretty much fallen to Nikki to do a lot of this, and that isn't acceptable. We've had that conversation at previous ICPs. I think we've just kind of uncomfortably shuffled in our seat and accepted that's the way it is, which is why some things haven't progressed in the way they have done. But I don't want to undermine for a minute the energy in the delivery group space. And, Nikki's been brilliant, and we try to pull on, resource and capacity where we can, but there's only so far you can go. But I think going forward, it's about, galvanisation, coordination, trying to join up, trying to have much more united conversations about these things.
Thank you. So there's a lot in that, and you know, I'll pick up a few of those things. But let's take another couple. So go to the back and then to the front here.
Thank you, Chair. I think it's to pick up that point as well, really. And I know there's been lots of positive work in this space, and I think we've achieved a lot with not a lot of resource, and a lot of that is down to Nikki and the partners at the table. Certainly in terms of the Families First partnership, we've got a really positive partnership in Derby. We're very much working together with voluntary sector, as well as our statutory partners. But again, the elephant definitely in the room is we have a sector at the moment that whilst there's this big reorganisation and lots of things happening at a system level, actually for the sector, lots of organisations are seeing that post-March, actually there is no funding. We've seen UK Shared Prosperity Fund that has now potentially gone. We don't know where that is. And actually the funding is getting more difficult to achieve when we have so much to do. So I think we need to not lose sight in terms of development and planning for this. The will is there, the relationships are there, but actually there has to be some funding to follow as well. And I think we need to have that very open, transparent and mature discussion as to say how are we going to make this happen and ensure that those organisations that are here now that we're planning for are still here later in the year, because we're going to need some of those organisations, absolutely. Not sure that was a question, Andy. I think it was more of a statement, but...
No, I think we'll take that, and I made note of that. I think we need to come back to that whole thing. So I've got some thoughts about what we might want to do regarding this group going forward, building on what people are saying. But thank you for that. Good point. So, Jim.
Thank you. It's more of a statement as well. So I suppose I'm trying to provide some hope here. I seem to spend quite a lot of my time going around trying to sell hope to people at the moment. I think so I really welcome the update. I can see there's the relationships are really important. The money is the money. There's not going to be lots of extra money coming. But from a hope perspective, from a neighbourhood perspective, where we have focused on, think about smoker cessation or the obesity work or some of the end-of-life work that's been going on at the other end of the start well spectrum, as it were, there hasn't been extra money being played in there either, but we have managed to achieve a lot of things through husbanding the resources that are already out there more effectively. And I think that's what you are both saying, which is we acknowledge there's unlikely to be more money coming, but there are still resources that we can organise maybe more effectively to deliver locally to what is required. And so I say, and I suppose it's to Duncan's point as well, yes, we've been trying to do this for a long time. I think stating it publicly here, this is the approach we're going to take, is half of the battle. The other half of the battle is, with no more resources, how do we then organise ourselves? Thank you.
Thank you. Oh, let's take another one. Yes, thank you.
Hi there, and apologies for being late. Just wanted to make a comment really from a Chesterfield district perspective. One of the reasons I was late is I came from the Chesterfield Health and Wellbeing Partnership, and actually we had a colleague from the County Council come to talk to us about family hubs and what they were doing, and the desire to put a family hub within Chesterfield, which is fantastic. But actually what we also talked about was how our community groups and community networks will feed in as part of the wider spokes within that system, and a really good commitment from the County Council to come and talk to our community groups about how we do that in a way that is collaborative and making best use of the resources we've got.
Well, that's great to hear as well. Yes, thank you.
No problem. So first of all, thank you just acknowledging this. And I'd just also like to underwrite Kim's point from a sector of the absolute phenomenal work that goes on in this department with Andy and Nikki and their teams, how there's been significant breakthroughs, that have come, which are scalable. So just acknowledging that. Also acknowledging the point about not doing anything new and expecting the same result. And also acknowledging the changes, is that we've raised a couple of times now the importance of having within the neighbourhood space a bottom-up delivery model. Okay, because this is what creates the systematic impact, this is what gives the leveraging, and this is what enables outcome-based commissioning, okay, where these are part of the equation. And allows the creativity, not just of the voluntary sector, but of others, to genuinely get in and work on this. If within that system, the model, there is a referral within action learning, which we've talked about in here before, if there's a referral for action learning of new approaches, that can be focused on. The impact, as Chris always says here about the impact and measuring the impact. If we are linked into that with a model that can then scale, we will see significant progress here. So I just want to keep raising that delivery model, because it's unusual to take on things like this without that, in my experience. Okay, thank you.
Thank you. There's a helpful comment. Oh, yes, sorry, over there.
Apologies, yeah, I'm in the corner out the way. So, Aaron Johnson, Bolsover District Council, Bolsover Partnership. So, just what Chris was talking about, and I know there's a few in the room that I've spoken to about the model that we use as well, and that is exactly that. It's that bottom-up approach, but that top-down strategic approach as well. We've done a lot of work around looking at the data in Bolsover around a lot of health metrics and the wider determinants of health, including education, skills, physical activity as well. And what we've done as a collective partnership is decided to take an approach around children and young people to start an impact on that data over a longer period of time. So we are just out to commission a piece of work around children and young people, and what that looks like is initially it's evidence gathering, but from the children and young people, so their voice. So what do they need? What will support them to help impact on these health metrics, which will then determine what is delivered in Bolsover locally. The evidence that we can get through that can be a test base that we can feed into here to see what worked, what didn't work, what we can take forward. So that's more than an offer from myself.
Fantastic.
Really.
That sounds really helpful. Do you want to just pick those points up?
Yes, please. Thank you, Chair. So I just wanted to pick up on the points around, the importance of us being driven by the needs and the voices of children and young people, and that is something that we're proactive in seeking that and ensuring that informs our plans. And I think, as Chris was saying, when we did some of the work around the ND hubs, we didn't come to the room with the solution and the agenda. We came with the challenge, and working with partners and with children is how we managed to get a really good solution. So it's absolutely crucial, as you said, that's the basis on which we build our plans. Thank you.
And just to add to that, Chair, I think we've taken a really purposeful strategic approach in the board to ensure that when we are reviewing and developing our priorities going forward, yes, there are statutory must-dos that we have to do because that's what comes out from the centre, but there's also scope to really think about how we might be able to add value in that broader partnership space. And we take a really purposeful view to pause and speak to children about what's important to them before we just set those priorities, and they genuinely have shaped our approach. So, for example, it'll come as no surprise that young people, mental health and support for mental health came out very strongly when we went through and did an engagement exercise. We try and bring the voice of young people into our development days as well, which is really powerful, isn't it, Nikki, thinking about the last development day we had. So it's really, really dynamic and it's so important.
Thank you. I think, Aaron, you want to come back?
Thank you, Chair. Just one last comment. So the approach that we're taking is going to be a real targeted approach. So we do know through looking at that data, our most deprived areas where we've got poorer health outcomes, school refusers. So it's how do you get the voice of that young person? Because ultimately that's what puts pressure on the system further down the line in these areas. So that's the approach we're taking. It's about using that trusted voice. So there's multiple partners involved in this space. So we have a children and young people's group locally at Bolsover that I set up on our chair. That's been running just over a year now. So we've got multiple partners that are working in Bolsover in that space. Once we gather that information, that voice, it's really difficult to do. We understand that trust is the key to be able to do that and gather that really granular information. Once we get that, like I say, that'll inform delivery, but it'll be devolve leadership to these organisations then, who's best placed to deliver that and devolve resources. So in the climate, I know we spoke about it briefly, so in this climate, a lot of people are trying to position themselves. So you're going to start and get a lot of siloed working. So what we've managed to do is try and pull everybody together to say, look, to really achieve what you're setting out to achieve, we've got to work better together. So it's pooling people's time, expertise and resources as well, and joining match funding to enable that to happen and try and achieve that end goal. And it's not a 2-year plan, it's not a 10-year plan, and it's got to be generational, it's got to be continuous, because if we don't, we'll still see the same issues we're seeing year on year.
Yes, thank you. So thank you for all those comments. I mean, and thank you for the paper and the work. If I can just sort of try and bring this together and add a few thoughts that I have around this. First of all, this is a key plank of our strategy, and I don't hear anything that anyone's saying we should deviate from that strategy. So I think we need to reinforce that as everybody here saying, you know, the start well, the sort of early years piece that we have in our strategy is absolutely key. So we're hearing some good progress. The second thing is, you know, you've shared some data in the paper. The bit that it feels to be, you know, thinking about the ICP is not a delivery organ, you know, everybody's doing that elsewhere. It is, however, a body that needs to see how are we progressing against the strategy. And for me, I would really love to see some more granular data, because I think what's going on probably in Quarndon is not the same as in Bolsover, or, do you know what I mean? I think we need to see that, and whether we use ultimately, you know, the geographical patches that amount to the neighbourhoods that are being described for the 10-year plan, or some other form of thing that's mutually agreed. I think we need to come to an agreement, and then I think we need to use the population health data, and you know, this school readiness marker seems to be like the #1 thing, but there might be some other simple metrics as well. I say simple, knowing perfectly well that it's really tricky, but you know, to have some metrics, almost a map of the patch. What's it like where? Because then you can understand what we need to focus on. And then I'd be really keen to see a bit slightly more granular picture of what have we got that we're doing together. So, you know, we talk about the voluntary sector. What's happening where? Are there some deserts across the patch, or are there some concentrated areas? You know, what are the elements that are going to make this move quickly? And we all recognise this is in the context of no brand new money coming into this. But if we don't fix that, I think your point about the generational thing, you know, I mean, I've been in all of this business for 43 years now, and I'm not going to be around in 43 years. But this, if we don't start, we already have started, but if we don't accelerate this, there'll be souls sitting in rooms like this in 20 years thinking, what did they do back in 2025? So I think it strikes me that there's a lot of support for really pushing forward on this, but I think more data, granular, a bit more about what are we actually doing where, and then we know that small pockets of money can sometimes help. You know, I've seen family mentoring, voluntary approaches. You know, there's a very good thing I went to in the city where they support at a sort of just born level, all involuntary, etc. But we have to work together on these things. So those would be my suggestions, really. I hope that's not too burdensome and you don't agree, but I would suggest we might want to then bring this element back. We're going to have discuss what's happening with ICPs, but let's assume for the minute we carry on and say in about, say, 6 months, if we could bring that back as part of that strategy, I think that would give us a bit of momentum on that. Is that all right for you? Yeah, thank you. Yes, just another comment.
Thank you. Councillor Mary Dooley from Bolsover. Yeah, totally agree about the data. We need the data to satisfy ourselves that we're doing the right thing. I'm privileged to be a nursery governor in Pinxton, nursery school, and at the last count we had 19 non-verbal children, and this is under 3, and that's sad, you know, but we're doing what we can. We've got our own strategy in place, and I think the bottom line is parents, you know, not giving them an iPad for the games to go and sit here, there and with anywhere, but to start learning and be verbal. There's 19 non-verbal children in our nursery, and hopefully the data that you collate from other areas, it'll show how bad it is.
I think that's a, you know, it's really stark, isn't it, on the ground when you see that sort of thing. So I think we've got an agreed way forward. I know this isn't a paper for decision, but I think it's fair that we think about the next steps. Is that okay with Andy and Nikki? Are you happy?
Yeah, that's really helpful, Chair. Thank you. We'll take that forward.
Thank you very much. Now we move on, I think, to the next paper, which I think, Robin, you're going to take us through, which is really about, we've sort of touched a little on some of this, haven't we? System changes, the timeline and current status. And then I think that will take us nicely into the development session we'll have to think about some of the questions around the future. So over to you.
Yes, thank you. So this is really giving us the background for our further conversations and is a summary of the changes that are currently happening and plan to happen within the system. So as you go through the paper, each of the areas of the system are summarised. So just to really give you the key headlines around those. So we start off in 4.2, looking at the development of the East Midlands Combined County Authority and the election of the mayor. And obviously there are some key local authority functions that are in the process of being transferred over to the mayor. And there will also be in the future some additional health duties as well sitting with the mayor. So it's a key part of our consideration as to how we develop in Derby and Derbyshire. As we then go through, we look at the other areas where there is going to be change. So from a local government perspective, we've had the announcement around local government reorganisation. So both the city and the county council have submitted, along with the district and borough councils, some proposals around future structure for unitary authority or authorities across Derbyshire. And they've now been submitted and we're awaiting a national consultation and a national decision on what our future structure will be. So, so this is something that is difficult to know what the implications will be for us for the future, but certainly as we come towards next summer, we should have a clearer indication as to where we're going to be moving to. And to say that the shadow elections for those authorities or authority will be in May 2027, and then the new unitary authority or authorities will be formally established April 2028. So on top of that, and moving much more quickly, is the NHS reorganisation. So as you mentioned, the clustering of Derby and Derbyshire, ICB with Lincolnshire and Nottinghamshire. And along with that, a refocusing of the function of ICBs and some key requirements there that you'll see listed in the paper from the NHS planning guidance. And part of this is a shift for the ICB towards population health and population health-based planning. And important to note as well that there's a requirement for our local NHS providers to reduce the cost of some of their corporate functions as well within these plans. And also a reduction within NHS England staffing over coming months, and an abolishment of NHS England and a move into the Department of Health and Social Care. So really all of these areas of change creating quite significant risks to us and our work, but also hopefully presenting us with great opportunities as well. And as is mentioned in the paper, one of the proposals is that integrated care partnerships will be abolished. And that is then where we come to our later conversation, just to consider these changes and to reflect together on what our potential future might be, to continue our conversation from our last meeting. So that's just a summary of what's within the paper. I'm not sure if there's any questions or whether we just move on to the development session. Thank you.
Thanks, Robin. I thought this was a really great distillation of what is a very complex set of things when you look across the whole of the public sector. And I suspect some of us might want to pinch it to share with other people, to be honest. So well done. I think that's super helpful. Are there any comments or questions for clarification or Duncan?
If it's okay, Chair, I just want to underline what you said on the last item, because I think it's probably more pertinent in this one as well, that all of these changes will be massively distracting and consume an enormous amount of bandwidth, and in themselves lead to the risk that you described of us being, or our children being in the position that we're in, having the same conversation. So I'd be really keen collectively if we don't lose sight of what we're actually trying to do, and not be distracted by all of this as much as is reasonably possible. So just sort of reiterating your previous point.
Yeah, I think far more eloquently, actually. But if I can just build on that, and you know, if you have been around a long time, you've seen many reorganisations. I think a number of us have seen many. The things that continue throughout are the relationships, and that seems to be the critical thing, you know, the work that you're doing at very local level, at sort of wider system level. And I think we're very fortunate here. I think relationships with different parties are good. And I think there is a risk in amongst all of this that we start looking purely at structures and not at actually some of the good things that are happening. So that would be my slight warning, but I do completely agree with Robin. I think there are huge opportunities here. For as long as I can remember, we've talked about community, moving, shifting that way. It's now sort of slightly more formalised. And I know the local government reforms are on a slightly different time frame, but actually that's galloping towards us. You know, we're nearly at the end of 2025. You know, when you say it's coming in 28, it's not that far away, actually. It's a sort of planning cycle, isn't it? It's not that far. So I think we need to be cognizant of this. But I think we need to focus on the things for our population that actually matter. And that would be my personal message for what it's worth. But yes.
I absolutely agree, Chair. I think really helpful paper. Thanks, Robin. And the one thing I would pick up is so for instance, as a voluntary and community sector across the piece, and communities working at a very local level, but also at a system level, we have, of course, from the integrated care system, got the VCSE alliances. And actually, we're meeting and joining up at the moment. So I think in terms of continuing to ensure those relationships, and we're talking to Lincolnshire and Nottingham and Nottinghamshire, we have there a real opportunity to make sure that we use what we've got and bring those together rather than sort of create something else. So again, I think it's the point that we don't want to lose the relationships that we have, or the systems, or the good bits that have come from this. And it is an informal network. But it's actually, I think, providing loads of really good intelligence, a very diverse range of groups, organisations, individuals, specialists, geographically placed organisations as well. And I think we need to really use the intelligence and the discussions coming from those organisations and those forums to also, and I suppose that's more into the development session, but actually in terms of this paper as well, we shouldn't lose those broader things that have been set up through the system that I wouldn't want to lose.
Thank you. And whilst you've mentioned, Kim, the VCSE again, just to share with colleagues that as we've set up the clustered board, we have, or I have as chair, have ensured that we've still got the voice of the VCSE at the table. And the way we're arranging that is that as we hold our boards in public 6 times a year, we will move around the counties. So we started last month in Lincolnshire, and then we'll be in I can't remember the order, Derbyshire and Nottinghamshire, but whichever one we're in, we will have so for Wynne will be the representative there when we're, twice a year when we're in Derbyshire. And we've done the same actually with public health, haven't we, that we have representation depending on the geography, so that we keep those voices. We're not required to have that, but it feels really important, so we are doing that. And I know that outside of those formal things, you all talk to each other, so that kind of keeps it joined up. So hopefully that's a helpful thing, that we will keep that sort of commissioning lens on that. So yeah, thank you. Yes, back to Aaron.
Yeah, thank you. Just to echo what Duncan said, particularly through the local government reorganisation, what they're saying is, you know, we're going to go into a bigger unitary authority, but we're going to still be able to stay close enough to the communities to address their needs. I can't see how that works, if I'm honest. we're losing more councillors. So for me, it's really important to have that local strategic partnership, that structure in place to ensure that happens, that all that data gets fed up and it gets fed up into that landscape. And fortunately for Bolsover, it was a local strategic partnership, but when they was abolished through government, Bolsover continued with their partnership. So it's that established partnership and trusted partnership that's been there over 20 years. So that's what makes it quite successful in drawing down resources, getting all that information of what's really needed for that community. So I'd be pushing personally that LSPs reappear in all of these different areas, that they come collectively together.
So I think you make a good point there, that as this all moves forward, we need to make sure that there's statutory things and then there's networks of people actually doing the work, isn't it? And what's the sensible level to do that? And I'm sure that will need to emerge through local authorities and health and probably other partners as well. So I think we need to note that that's an important thing as we go forward. Any other points? Yes.
Sorry, just to commend also the Bolsover partnership. I know a bit about that, and in terms of development theory and practice, they're a very good example of a releasing organisation rather than controlling, which is what a lot of the work has been looking at, trying to change the approaches. So with governance, you've got to control. But in terms of releasing action and integrating work and bringing things together, 1 + 1 = 3, they're a very good example of a releasing partnership. So it's an LSP, but they really consult and they use all the assets and they use it the way those assets want to be used so that they work at their maximum potential. They also link, so they do all the right things that will, use a smaller budget and increase the value of that budget significantly, which is what we all need at this time. Thank you.
Yeah, thank you. That's another important point. So hopefully thank you very much, Robin, for that paper. Hopefully that just helps us as we move, understand a bit more about the landscape. Because you know your own bit, you're not necessarily as familiar with other people's bits. So that's really helpful. In terms of this particular meeting, I think we've finished the main items. I think it's fair to say I haven't had any additional things passed to me. So there are no other matters arising, etc., no added business or whatever. So I think we can close the meeting in public, and I think we're meeting in the